And complexity theory sees the idea of organisations as very complex yet self-organising systems. And this is because complexity theory sees organisation as what they talk about being non-hierarchical, evolving, self-organising, self-regulating, what they call a chaotic system. And the aim of this is not to go too deeply into the various paradigms and theories, rather it's to demonstrate that organisations do have a wide range of options and choices open to them as to how they are structured and operate. And healthcare is no different. The ability to achieve change seems to be one of the most difficult challenges healthcare managers can face. Traditionally, many change management and implementation processes have been viewed as linear. Complex theory argues that it's not linear, and especially in the healthcare environment. So complexity refers to the many interactions between different components in a system, which produces behaviours and roles that emerge from those interactions. In healthcare, complex systems involves networks of clinicians, managers, policymakers and patients, as well as the tools, equipment, procedures that they use, all aimed at one common purpose. Complex interactions can be seen as a fluctuating relationship with work colleagues depending on their mood, depending on the differing patients that we see, depending on when things go awry, like missing x-rays, or procedures that take longer or shorter than they planned. This creates a complex environment. Another way of looking at the healthcare system is that through what we call complex adaptive systems. And this is a way of thinking about how to analyse things by not sort of seeing complexity as something that's difficult, but by using complex adaptive systems to be able to look at their patterns and their interrelationships rather than just looking at cause and effect. In complex adaptive systems, they're not seen as a mechanistic approach. They can't be broken down into the sum of its parts to have a look and see how it works, like you would a car engine, or probably more in the more expensive watches or old watches, breaking down the mechanism of a watch. This is because the whole is not only the sum of all the parts, but each part is inherently different. While a linear approach has its advantages in everyday clinical work, such as medication order in a pharmacy, which follows clear rules and procedures, understanding complexity and complex adaptive systems gives the health service manager an opportunity to view the healthcare system in which they work in a different light. Rather than rationalising in a linear way, which may be too restrictive, adapting complexity theory may assist in creating change. So what we've looked at and what we will look at in the course is this idea around the classic postmodern realist approach and complex adaptive systems. In your understanding, maybe as a manager yourself, where do you fit in those theories? Do you have a classic approach where there's only one rule, or more of a realist approach where we take into account some of the social, political and environmental aspects of our management? Thank you.